Welcome to Snip and Sip, the podcast where we cut through the noise about plastic surgery while sipping our drink of the day. I'm your host, Dr. Scottsdale, from my real name, Dr. Mata. We're gonna talk about funny, we're gonna talk about trends, we're gonna spill the tea and all the secrets. All right, guys, welcome back to, what episode are we on? 12. You guys lost track. This is episode 12 of Snip and Sip. It's our podcast talking about what?
Everything and anything. What we're talking about, tweakments.
Oh, what are tweakments?
I don't know. Could you elaborate?
Well, it sounds like you don't know what you're talking about. But anyways, before we get into our topic today, I'm joined by my lovely co-host, which is Nurse Scottsdale, my wife, and
her sister.
Yeah, she doesn't have a name, and that's the way we like it. But anyways, we're going to be talking about tweakments. But before we get started, if you watched our last episode, I said I would talk about my medical mission trip. So I went to Africa, give or take about 5 or 6 weeks ago. And it's the second time I've been to Africa, and it was, I would say, better this time because I think we selected the patients a little bit better, meaning they put out there that there's a plastic surgeon that does cleft lips, cleft palates. We still got a lot of wounds, and the thing about wounds is that anybody can take care of them. The hard part is that as a plastic surgeon, usually when we do flaps or things to kind of fix these wounds, we need things to be clean and healthy. When they show up and they are full of the smell of bacteria, of just bad stuff, you can't fix it. And then they put it on us, the quote-unquote U.S. doctors that can fix anything, to be like, hey, fix it. And I immediately tell them, I can't, because no matter what I do, it's going to die. You don't try to cook food that's rotten, you have to throw it away.
What do you mean by it's going to die? The skin.
The skin, the flap. So if I put an implant into an affected area, that implant's going to get infected. It's the same thing with skin. It's the same thing with anything. The reality is, for us to take care of a wound, it has to have a bacterial count of 10 to the 5th or less. That means it has to have 10,000 bacteria or less per area for the body to be able, or for the muscle flap to be able to heal this. If it's not, you put a piece of skin graft, the bacteria will literally eat the skin graft away. It will literally eat it. If you put a piece of skin and fat there, the bacteria will eat it. It will literally destroy it. So it's kind of a hard situation. And I'll post some pictures up here that you guys can kind of see some of the cases that we worked on when we were on this mission trip. We did a little bit of everything from head to toes, literally. Would you say I was a little bit better this year?
Oh, yeah. It was way better. I think you came back happier.
Well, Nina was able to do some surgeries. I got to do some bilateral cleft lips, and those are rare, more rare than just a regular cleft lip. So it was kind of nice to do things that I'm passionate about. That's the reason I go, is to fix these cleft lips, cleft palates. Usually I get a lot of cleft palates or secondary reconstruction, meaning that they still have a hole between their premaxilla and their maxilla, which basically means where your canine teeth come in, there's a big hole. And if there's no bone there, the tooth literally just falls right out of your mouth. Like you'll eat one day and it just falls out. And it's funny because we have a case here in the United States that we're going to do pro bono, where this little girl who's about 8 or 9, I think, has these holes in between her teeth where it looks like it's together, but there's a big hole. And we got what's called a Panorex, or an x-ray of the teeth, where it shows her canine teeth or her Wolverine teeth are coming in, but if there's no bone, they're going to fall off. So we have to put her on the schedule before I forget. But those are the cases that I typically see, because on these mission trips, most doctors are like, yeah, that's a really hard surgery. It's complicated. You got to move tissue, and you basically have to create a sandwich, meaning that the top has, if you stick your finger in your nose and you push down, you feel something, right? There's skin there. Well, below that skin, there's bone, and below that, you have the inside of your mouth, which is your gums. So we have to create, again, the hole literally goes from your nose all the way to your mouth. So we have to make skin that comes from the bottom up and from the top, it has to come down. So it has to have a sandwich of skin and then bone in the middle. So it's kind of complicated because you have to borrow skin from right there. And you're like, but it's missing skin. It's the same thing when we do a cleft lip. We literally are moving skin around in order to make something from nothing.
So you mentioned that you did more bilaterals than regular. So what's the difference with that? Is that another hole?
Well, it just means the lip has one part that's split, or it's split into two parts. So that you have the part in the middle and then two lips. Or you have part of your lip that comes on one side, but the other side has a hole. So bilateral, just, yep, and you have what's called the prolabium, or the middle part, where it just kind of sticks out. And that's the scary part, because you look at these babies and you're like, oh my gosh, they just look really, really weird. But they're probably more challenging because you have to put the bone back together. And usually that front part of your bone is literally sticking out right under your nose. So they ultimately will need a rhinoplasty for sure, and jaw surgery because their jaw doesn't grow right. But you can tell I love talking about this stuff. And I mean, that's probably what I would do every day if my life kind of allowed for it. But it doesn't. I didn't get to go to Australia or to France or anywhere in the U.S. to do additional training. But that's why I still go on the admission trips to kind of keep my head on straight.
I know before, like a few podcasts ago, you said your beautiful wife was going with you. Did that happen? Did you ring someone else? And what did...
Well, I think, the hard part about the situation is that my lovely wife was going to join me, but we decided against it. And I'll let her expand upon that if she wants to or not.
Well, I was going to go, and we decided not to because I was pregnant and I couldn't get the yellow fever vaccine, and it just didn't work out.
So, yeah, she didn't go. But anyways, kind of moving on, I was fortunate enough to take one of my nurses who everybody said was a rock star, because when we go over there, the best help is the help that you bring. Because over there, the world runs at a different pace, at a different schedule. But I would tell you, this last time I went, we literally started operating. We got up at 6 in the morning. We were at the hospital by like 7:30. We started operating after the patient showed up, this and that, from 8:30 to 9 a.m. to about 11:30 to 12 a.m., sometimes 12:30 a.m.
I saw that with like 150-something surgeries done, right?
I mean, we broke the record for most surgeries in 6 days. But the hard part that I have about that, it's not the number of surgeries that you do. It's not. And I know it's like, oh my gosh, everyone always asks when I get back, how many surgeries did you do? It's kind of like I go through this with our daughter. Hey, did you score any goals? It shouldn't be about that. It should be about how many lives could you change? And I know people look at surgery as lives changed, but it shouldn't be about the number. It's about the quality of what you're doing. And that's why some doctors don't go, because the follow-up that you get there, the resources for antibiotics, sometimes when you do things where things fall apart because there's no antibiotics. And so you don't want to take these things kind of for granted that we do in the U.S. You're like, oh, we do something and it's fine. And again, when we do this bone graft, these kids have to be on antibiotics for 3 weeks because the skin has to heal above and below because there's boogers, there's bacteria inside your mouth, there's a lot of bacteria. And so the worst complication is you take bone from their hip, you put it, you do all this reconstruction, you're so proud of yourself that you're like, oh my gosh, it's amazing. And then they get an infection and the bacteria eats the bone away, and then you did it for nothing. And now when you try to go back, it's all scarred, which makes it harder the second time. So, but anyways, this episode is not about the mission trip. It is about Tweakments. So we will move on to the topic of what is our drink of the day, Alondra, since you're the bartender extraordinaire at
A
Hop Bar.
virgin. Yes, a virgin.
But you're not a virgin.
Yes, I am. We've established this. I'm a virgin. So it is some sparkling water with some strawberry flavoring. So
Okay. All right. So
a little bit of lime juice.
the only virgin here today.
That's just me. I ain't even.
Actually, but good.
It's not bad.
It's refreshing.
Refreshing.
Fair enough.
We should have a cranberry one next time to be in the holiday spirit.
Okay, this holiday. So what are Tweakments, Nurse Scottsdale?
They are just little tweaks. It could be
Could be. Let's look at her. She literally lost her. Oh,
the treatments. It could be fillers. It could be laser treatments. But I gotta say that nowadays people try to look more natural than not. So they're trying to shy away from fillers and doing more treatments,
body.
like laser treatments, Elacore, that'll just set out, yes, more natural, subtle change.
But is that the purpose of Botox and fillers, was to have a natural result?
Yes, but some people think fillers are not natural. And I think they see it out like on TV where people are like overfill. Yeah, and they want to shy away from it. Yeah.
Yeah, or like when people have the frozen face and they can't do anything, like any expression, where it's overdone so it doesn't look natural anymore.
Yes, which I still feel should have a place. But just trying to do a little more. The less the better.
The fastest growing industry in the cosmetic industry, do you guys know what that is?
The fastest industry in the cosmetic industry.
The fastest growing, I guess, treatments or procedures in the cosmetic surgery or cosmetic med spa industry.
I think fillers and Botox.
Yep. Lasers, Botox, and fillers. The number one most done treatment in all of the United States. You put those three, depending on the year, it's all the same. It's Botox, it's fillers, it's lasers.
So it just depends on how much people want to get, but it's always the same treatment.
Correct. That's why there's a med spa literally around every corner.
Well, in Scottsdale, we don't know anywhere else.
No, it's everywhere. It doesn't matter. You can go to the middle of nowhere and you're going to find a med spa. I was literally, before this podcast, I was reading about a med spa here in the Chandler or Gilbert area where there's a provider who is not a doctor and not a nurse doing awake liposuction. So I'll let you guys figure what that means. And that's a loophole because technically they're not allowed to do surgery on somebody who has any kind of sedation.
Oh, but no, they're not.
Because it's local, you've eliminated the need for having help or the appropriate resources. And because you charge cheap, you'll probably get a lot of patients because they don't know the difference.
Probably people don't ask a lot of questions. They just
I need your marketing.
Right.
Hey, liposuction.
Or
With a med spa.
Correct. It sounds really good. And again, this kind of falls in line where with these tweakments that you're like, hey, I just need a little bit of
tweak here.
lunchtime lipo. It's a little tweak, right? And it's still a surgical procedure, no matter how you view it, whether it's awake, whether it's asleep, whether it's light sedation, deep sedation, it's a procedure. And again, people can have issues from simple procedures. And I think, that is the biggest thing that even with all the training in the world, stuff happens. And I wish I could tell you it doesn't, but it does. Excuse me. But I think the biggest thing is making sure that whoever is doing your tweakments, one, has experience doing them, is credentialed to do them, and ask a simple question. If there is a problem, how would you fix it? All right? Because nobody is perfect, and some problems we can't fix. So understand from the perspective of any tweakments, you need to see nurses that have training more than a weekend course, that are working at reputable doctors' offices, or just renting a room at whatever place or doing it at their house or out of their car or getting products that are not FDA approved. Because the reality is, if you go on eBay, you could probably buy fillers for $1 a cc, and you're like, oh my gosh, I'm paying like what, $500-$600 in the US.
Well, you guys said there you had like a bunch of lip filler patients come in, right?
But the lady who got the stuff from Extra and got infected.
Correct? Because she was selling it for $100 per syringe.
Yeah.
You're like, damn, that's cheap. You're like, man, sign me up for 4, right? That's the cost of maybe 1 in the U.S.
Saving it from China too. You can get Botox. I mean, there was something else that was going on, right? Some people getting Botox from China and having a really bad reaction. So you can find all these products. You can go to Alibaba, one of those websites, and to literally find.
You know, and I think the sad part about all this stuff is you're putting your... Just think about it. If it's too good to be true, it is. Right? If somebody's selling you a Lamborghini for $10,000...
It's not, Brian.
There's something wrong. Like, seriously. If somebody's selling you lipo for $5,000 and everybody in town's at least $10,000 plus... There's something wrong with this. Don't think you're getting a deal. If you get away with it, great. If you don't, you're in for a mess of trouble. I recently saw this patient who I did nose filler. And she was happy, and I think it lasted a couple of years. And she called the office. It'd been 3 years. And she calls the office and, hey, I need to see Dr. Mata. I had nose filler somewhere else, and I don't like it. And so she spent maybe 10 times what she spent to get the nose filler to get it removed by me. And I don't care where people go or what they do. I'm always here no matter what, right?
When they cheat on.
Yes, when they cheat on me and they go somewhere else. And here's the catch. Nurse Scottsdale is a fabulous injector, and she could totally do nose filler. But why don't you do it?
The risks. And it's pretty risky.
And I've been trying DOD.
And I think, part of the dynamics is when I do it, I'm very conscientious. I try to use cannulas, not sharp needles, because if you're wrong, you could go blind. Like, you literally could go blind from getting nose filler, which is scary as shit, right? Like, and you're doing this at somebody's house with a product that you don't know. And again, somebody brought up a valid point on TikTok. All fillers can cause necrosis, but it's not the filler that causes necrosis. It's the filler that blocks a blood vessel. And the blood vessel stops blood flow, so the skin dies. That's how necrosis works, whether it's FDA approved or not. But when I mean not FDA approved, I'm meaning stuff that when you inject it, you can't get rid of. It's stuck there. It's going to build scar tissue. And that's kind of what I remove as a surgeon. And so I saw this girl and I was like, well, I don't know what product you have, but we'll dissolve it. And luckily for her, it did dissolve. And she was happy. And again, she did spend a lot of money to kind of correct it. And then she saw me like 2 weeks later. It's like, I want it all gone. And I said, but it looks good. And you spent money to get it put in. You spent money to get it fixed. And now you want to spend a little bit more money to get rid of all of it. And so right now she's deciding if that's the route she wants to go. But I think she's going to be happy in the end. But again, going back to the whole Tweakments stuff, go to somebody who is reputable. Nurse Scottsdale's been doing this for what, 6 years now, 7 years? Mm-hmm. So it's kind of a little bit of a period of time, right? I've been doing this since 2011, so 13, 14 years going on that. And even then, there are things that are constantly evolving and learning. I think the biggest thing for me was this MRI study, right? You remember that one? Where somebody had like 20 syringes over however period of time, and they did it in MRI, and oh my God, there's still filler there. Well, duh. Just because time goes on doesn't mean that the filler is going to go away. Your body, and this is where I laugh because people say, hey, I want to be natural. Hyaluronic acid is a naturally occurring substance in your body. Your body has hyaluronic acid.
It is. But when you keep adding and adding and adding, it's just not going to go away.
Yeah, I think when it looks like it's so much, you
start getting that puffy look.
But the problem with that is not the patient's fault. That is the provider's fault. When somebody looks bad, it is not the patient's fault. It is the person who took their money to do something they didn't need.
That's true, but that's what they want.
Correct. But we walk a fine line. And the reason I say this is that I can do something safely, and it's within the boundaries of what's I guess okay, then I do it. And that's where we walk a fine line. If somebody has a BMI of 20 and they want lipo, they saw 9 surgeons that said, hey, you don't have any fat, you don't do it. And I see it and I'm like, I could get rid of 300 cc's of fat, I do it. So I walk that fine line in terms of what is right, what is wrong, and sometimes just saying no. I mean, and that's a hard thing, right? Because you're like, I want bigger lips. I want my nose filled. And some people are saying, you look good.
Hey, give me your money. I'll do it.
Well, I feel like it's been enough time, but I might let have gone down.
Compared to what?
Compared to some DSL by Nixon. That's it.
Okay, there you guys have it. She wants a DSL. So you know who you are. You know what she's capable of.
No, I wouldn't know.
Yes, but I mean, I disagree. I know how to say no, and some people trust me, and
most of them don't, and then they go somewhere else, and then they get back.
yeah, and then I have to dissolve it.
Yeah. But I think what you guys were saying earlier about like making sure they're a reputable source is hard because if you go to a med spa that's established that has, you're going to assume whoever the provider is reputable. So how do you even know at that point?
There's not a lot of certification that really comes with Botox and fillers, maybe a little bit with lasers. But you have to understand that anybody who has a PA and MP, a nursing degree can pretty much do this. The only and even medical assistants can do Botox and fillers in the United States because they're allowed to give injections. And there's some very gifted people that, like I said, could be a medical assistant and inject better than somebody who's a PA or a nurse practitioner, for example, or even a physician. But I think the big difference, and I always say the luxury that she has is she can say no because she's not worried about how much money she makes. You can sit here and say no versus if she had 3 kids to support plus a sister, she'd be like, okay, fine, we'll do it. I'm not going to hurt anybody, but I'm going to do it. And I think that's the problem with what we see is that people do it for the money. Most people that are not trained in cosmetic surgery go into cosmetic surgery. Why? Because it makes money. They have very little training for most of them. The ones that are doing, like I said, non-credentialed, awake liposuction with no real basis. It's because it makes money. Did they go to school for 6 years like I did to learn all the plastic surgery, not just to say, hey, I took a weekend course or I followed somebody for a couple of months and now I know how to do it on my own? Again, what you learn in school is not really how to do the surgery. Yes, you learn a little bit of that. But the biggest thing you learn is the decision-making of when to do something, when not to do something. That is the biggest thing that you learn in school.
So what could go wrong for like liposuction visually, like aesthetic-wise?
Well, it
'Cause
could be lumpy bumpy.
Okay, because I was going to say, I mean, it just seems pretty
Easy.
easy.
No, you can do it now.
I could probably do it. I've seen it on the sun.
Like out there? Yeah.
Every day.
I think the difference
Probably.
when you talk about it looking bad is everybody thinks they can do what we do until they get in the OR and then they start doing it by themselves and they're like, ooh, is this the right place? Is this where I need to be to suck this fat out? There's different layers of fat. You want to take more in some, less in others. And if you're too deep, you get into the intestines. And so now you start pooping inside your stomach instead of down the poop chute at the bottom. People have died from liposuction. Fat can go anywhere. This is the thing you have to understand. Anytime you have liposuction, fat will go into your bloodstream. Every single time you have liposuction, fat will go into your circulation. It just happens. We know this. But the fat is really small. And as you circulate, your body will basically turn this fat into little lipids. It absorbs it. It gets rid of it. It's not the end of the world. But if you get a big chunk of fat that goes somewhere and basically occludes your heart or your lungs, you die. That's what's called a fat embolism. And usually it happens from putting fat under the muscle, or you put it under the muscle. There's a blood vessel, big blood vessel. It takes this chunk of fat, like a third of this piece of ice right here. And then it goes, and if your blood vessel's that big into your heart, it basically fills it. No more blood can go in. No blood going in, no oxygen, it dies. You die.
Is that like when your performance or
Yeah.
is it like days after that?
Nope. When it happens, it has to happen usually within minutes. The longest I've seen it reported is 30 minutes from surgery, where usually you're doing the surgery and all of a sudden somebody stops breathing. There's a problem. That's because the fat went where it wasn't supposed to.
And there's nothing you could do at that point.
You put them on a breathing machine and hope for the best. Sometimes you can basically circulate their blood out of their body, something called ECMO. And those are things that, like I said, can happen to anybody who's doing a liposuction, whether awake, general, it doesn't matter. It happens to anybody.
Yeah, so someone who's not a doctor and that happened and they're in doing lipo.
Good luck. Again, you paid. And again, it can happen anywhere to anybody. And this is the scariest part about what we do. And part of this is making sure that you know who's doing your surgery. Hey, if something, it's awake, it's okay, there's no risk, it's safer. It is still liposuction. You're still going to get fat that's going to go into your bloodstream. Like, it is a real deal. And again, I'm including lipo and Tweakments because everyone's like, it's awake. There's no downtime. Like, I can just go and have it during lunchtime and I can go back to work because I'm awake. I can drive myself there, drive myself home. Yep, just really fast awake. And like I said, all it takes is one bad circumstance and all of a sudden everything changes. Wouldn't you agree?
I agree.
So let's get a little bit more into the details of what kind of things are considered tweakments. I consider a weak liposuction a tweakment. What do you consider a tweakment?
And many smaller procedures that don't have a lot of downtime. It means a little tweak.
Like, what do you think, Alameda?
I'm thinking like a little laser, a little some here and there, like Elcor or Morpheus. Like it's a big thing, but it tweaks like in little increments.
I was just say like the boot job with that a little tweak.
I don't think that the little tweak, well, depending on the surgery, yeah. I don't think it's a little, I see some big tweaks.
Like when I go from a D to a double D, that's a
I
little.
read a penile enhancement, a magic shot. Is that a tweakment?
I don't think that's a little tweakment.
It depends if it's starting little. When it's a little bit bigger, it's a tweakment.
I don't know.
And he could tweak some stuff with that.
It depends how much treatment they get. Same with the boob job.
It's a filler, it's a little tweak.
Yeah, but it's to a sensitive area. But I think, from my perspective, we have lasers. You have ablative, non-ablative. You have photofacials, intense pulse light. You have Botox fillers.
Funny.
You have threads. That's a laser for the vagina, correct. You have platelet-rich plasma or PRP. You have exosomes.
You had radio frequency.
That's right. Skin tightening, radio frequency.
Yeah, I felt like everything.
Yeah, I mean, these are all things that we all have. I think one of the things that I think people are, kind of shifting towards, at least as Nurse Scottsdale is talking about, is natural, right? Well, if you think about food, is organic food more expensive than regular food? Why?
Because that's what the government's not trying to have us eat. They want to kill us.
Okay, anyways, get off your soapbox. But why is organic food more expensive?
Because they don't use preservatives, so it's more expensive too.
So it's more expensive because it's better for you, right? Mm-hmm. So if you wanted to go the natural route, do you think that would be cheaper or more expensive than a quote-unquote organic route of?
But depends kind of natural route. Because natural could be, I don't get anything done, I'm just going natural. Or want to look good, but natural.
Same with like, you know how people say, like how guys are like, I want natural makeup on a girl. Like they just want it natural. They don't like makeup. But then if you ask them, they always like the light makeup. It's still makeup, but it's not a lot.
They're like the girl that one is also not you.
So I'm not wearing right now.
Really? So if I go like this, get a napkin and wipe it on you, no makeup's going to come off?
That's right.
She's full of shit, guys.
That's why we've washed our rings.
And whatever else. But anyways, I think the point that I'm trying to get at is that some people are using what are called PRP PRFM. You know what that is then? Platelet-rich fibrin matrix. That's where you take your plasma and you congeal it so that it becomes almost like a filler. And it is 100% natural. It does not cause occlusions because you're using your own body into your own body. So if it goes into your bloodstream, your body is like, oh, I know this. It's not a problem. But the catch is that it doesn't last as long and it costs more money, right? Mm-hmm. But more people are like, oh, I just want you to put soy here. I'm like, well, we can do something more natural, but it's going to cost more. Oh, yeah, no, I don't want that. It's like the same thing as bananas are 50 cents or $1.50 for organic. And you're like, but they look the same. But one is healthier.
Feel better when you know it's organic.
I know. I do. It tastes good. But that's
it's a little better than now all these chemical, that you're injecting.
Yeah, you don't feel so guilty about all the chemicals.
But I would say Tweakments are going the route of more natural. But I think more natural means PRP, platelet-rich fibrin matrix, which is more expensive than regular fillers. So you have to understand, you want to go au naturel, it's going to cost more money if you still want to be refreshed. Not basically I'm going natural and I'm just going to age and look like shit.
Yeah, to me, Tweakment is also easy to recover. It's just a little here.
How about chin lipo? Is that considered?
Is it an easy recovery?
It's a week? 2 weeks?
I feel like it's a little tweak.
I feel like fillers are quick. It's like one session and you have your...
Lipo's 20 minutes? 10 minutes for the neck?
Fair.
Yeah.
I think if you get it done in section, that might be a little tweak versus doing everything.
Or like your bluff. You do?
Yeah, that's
But again, that's surgery, right? You're physically removing skin. That's not How about a buccal fat pad removal? Trying to get that...
You can do that away, can't
It is a way.
I think that's a tweak.
See, again, we can't even come to a conclusion on this surgery or non-surgery or Tweakment.
That's what I'm saying. I feel like it's recovery time and the neck.
How about cost?
No, I don't think cost.
Cost is no bearing?
No, not as at the tweak.
I think you can get your whole body done, everything, and it could be a little tweak if you get it done in areas, right?
I think a tweak is something cute as and dainty, very demure,
Very mindful.
very mindful, very cute. Is a tweak.
It's not.
Do one food first, and then
The other one. So that's the tweak.
it's the tweak, yeah.
It's a tweak here and there.
I'd love to see you ladies walking around with one titty instead of two.
One lopsided titty. Or just
It actually happens when somebody pops their implant and they have saline.
It's just like our food rating. One titty out of two.
Mm-hmm. One titty out of two.
Speaking of which, you want to talk about that?
Well, actually, on Tuesdays, if you follow our social media accounts on Tuesdays, we're going to be doing what, Alondra?
Tasty Tuesday.
Well, Tasty Titty Tuesdays. We're not tasting titties, but
I would hope not on the internet. These hands, guys. Saving for that. Not for Instagram.
yes, not for Instagram. But we're going to be tasting food from a variety of restaurants on Tuesdays, where Nurse Scottsdale will join me for most of them. But we're going to taste them and give honest opinions. And our rating categories is going to be titties. So 1 titty, 2 titties, half a titty and a half. You guys know what I'm talking about. Because again, not all titties are the same. Some are big and some are small. So maybe you get 2 full-size titties. That means you're doing just right with that food.
We should rate it to cup sizes. We could be 2 triple A, Z, C, D, triple D. That's
a pound. Yeah.
But what if it's a G?
Okay.
That's even better. That's what you were, huh?
No.
Yeah, you were when you were pregnant.
Oh, yeah. She was.
You also, and then you were so tiny still too, because you didn't even grow your tummy. You were just boobs. That was it. You were just boobs.
So, why do you think people do Tweakments?
Because we want to live there.
Really?
Yeah.
Is that the only reason?
Everyone's always so obsessed with themselves. We're always
So you're obsessed with yourself?
Yeah. Whenever what's wrong, in looking for ways to improve. Even if you do a Tweakment and let's say you're insecure about one thing and you fix it, now it's on to the next thing that you're insecure about.
I think we know is you because we want to look better. We want to age gracefully.
Fair enough. I don't necessarily disagree with that. I think we get one life and you got to live your best life every single day. Because tomorrow, you might not wake up. You might literally wake up, get in an accident, and that's it. You're gone. And you're like, damn, I never got to do what? That's the question. I think for me, Tweakments are a nice little touch up to the big changes. And I think I saw somebody talking about how most celebrities do Tweakments here and there, and they show them to people, most people. But the big things that they do will be fast and done. And it's like, well, I could do little tweaks, or hey, I'm just going to have a facelift, hide myself for a couple weeks, and then bam, I'm done. Well, then that buys you a lot of time. But sometimes you have to do major surgery to end up with a subtle result. Because if you keep doing tweak after tweak after tweak, then you end up looking like Demi Moore or Madonna. Wait,
They both look good now.
But think about the procedures that they had where they had Tweakments that didn't turn out so good.
Oh, yeah.
Or you look at Kylie Jenner, right? Didn't she have some filler at the gala?
Yeah, underneath her eye.
And then everybody's like, ooh, somebody did it wrong. And you saw all these injectors. Oh my gosh, she's overdone. Do you think the person that treated her thought she looked overdone? Hell no, because
Now we have billionaires like, here, do my under eyes.
exactly. Do you think that injector, whoever they were, thought that Kylie Jenner looked overdone when they were done? Absolutely not, because he's like, shit, that's my business, that's my life. And so Kylie seeing all that, do you think she was going to go back to that person?
Well, but this is like, yeah,
And people have to be out and about. They have to show face, and sometimes they don't.
But again, would you really do that before one of the biggest, most televised, most watched events that everybody's literally looking at you?
Well, sometimes people don't know. They don't think about like, oh, I'll give it a week. And
Do you think that Jenners would not know that?
Oh, I don't know. I mean, I'm sure they know, but
I think that's just a total F up on their parts.
okay, I have one for you guys. Do you guys think that or like IVs and stuff like that are
Tweaks?
Yeah.
Absolutely. Because I wouldn't even consider that a tweakment. I'd consider that just general health. I mean, we do offer MAD in the office for our IV therapies. I actually take it by amount.
Or hormones. Like,
Hormones,
it's like,
those are tweakments. And actually, if your hormones are off whack, you're not going to look as good. You're going to age really fast, especially most women after they start menopause or perimenopause or around menopause. All of a sudden, they're like this, awesome, and then they like almost fall off the cliff. So if their hormones are not like up to par, I'm sorry, guys, or partners, you can have a hard time because they're not going to be interested in anything you have to offer.
I feel like tweaks are like maintenance, right? Like your car needs maintenance, right? Oil changes, needing new tires.
Car washes?
It needs a lot. Like your house also needs paint jobs. Like your maybe dishwasher might go out.
but like most of I neglect those things. Like, I don't do
So we also need maintenance.
And that's why you don't have a car?
and that's why I don't have a car, and that's why I don't get touched up.
So you can't afford that.
I can't afford it.
But what do you think people would choose over the holidays? Since we are in November, it's almost Thanksgiving, it's almost Christmas, it's almost the New Year's. Do you think people want surgery or tweakments?
I feel like it's like a big suck because then you have time to recover and you're home and you have more days off. And then for the summer, you're like, bam.
So it depends. Some people just want little tweaks to look good for the holidays. And some people do have time to do major surgery. They don't care. They're like, I have the time and I'm just going to do it.
I think it depends. Because for me, I mean, we're still relatively busy. And I agree with Alondra here that most people will do major stuff in the winter. So by the time February, March comes, they're like, bam, I'm bikini ready. Usually you need a good 3 to 4 months to let everything be where it's going to be. Ideally, at 6 weeks, you can do everything and anything, but you're not totally right. It takes a good 3 to 6 months to really be like, damn, I look good. You hit the gym again, you're back to normal. Most of the swelling's kind of gone. You're like looking like hot shit.
and you can wear like oversized clothes and hot. You know, like if you're, and then cold.
You can be frumpy like you are normally.
In peace.
10 in piece. Fair enough. And I think Tweakments to me almost seem like body is different than face. Most people will do Tweakments to their face because they're like, oh, I don't want a facelift or a neck lift. And that's where things like Elocore, which is our newest device that basically is micro-coring that gets rid of your skin without scarring, which is pretty crazy. It only does 8% though, so it is, you have to do it more than once for the best results. But I'm greedy. I knew I probably won't get a facelift, but if I could do that over and over again and kind of look like I had a facelift without having one without scars.
Doing it 10 times.
That's right. I moved close to 80% of my skin. That's pretty impressive.
I'll be doing if I'm there in a couple weeks.
There you go. Stay tuned. She wants round 2, right?
Oh, you're doing it or you're doing it for him?
No, she's already, or she's gonna do it on me.
Do you have Bloody?
I have the sources. Yeah, I have someone who can record it, and it could be a marketing a write-off.
I'm recording her, so move it now.
So it could be alright, huh? No, I mean I did it last year, and I wish I would have done it more. It's just the downtime.
What's the downside?
Downtime.
Like 3 to 5 days?
Like 5 days.
Yeah, you're kind of red. You don't want to go out in public. You're swollen. But she needs a lot of numbing medicine. That's why. If we didn't need a lot, we'd be in and out. And she bruises a lot. Like I could go away and she'll go higher bruise tomorrow because that's my luck. I married a woman that bruises a lot. It's not my fault. She bruises everything.
That's right. You won't hit me because if you
That's why. That's the only.
Yes, exactly why I won't hit you.
That's the only reason.
Because you bruise. Oh my gosh, there you go. You guys see it. So she'll have a bruise when we're walking out in public. And
Frank saw it here first.
Yes. Oh my goodness. So what do you think the future of Tweakments are?
How can we get big? Like more and more. Like it's not like a buccal fat pad. We can consider a tweakment, but that's still surgery. So like, you know, like more invasive stuff, but like it's done quicker, more efficiently. And, you know, like with less downtime. So I feel like we get more bang for our buck, basically.
More banging.
But I guess technology is evolving. I mean, we might get new.
Well, I would sit here and tell you 2-3 years ago, there was no Elocore. There was no scarless skin removal. I mean, 7 years ago, there was shitty skin tightening. Now there's Renuvion, there's Body Tight, Face Tight, AccuTight. And I'm sure if we wait long enough, there's going to be newer, better devices. Oh, there's the more, not Morpheus, but InMode Ignite, which is not bipolar, it's monopolar radio frequency. So I mean, there's all these things that as technology continues to grow and evolve, it will continue to get better. But is that leaning more towards surgery or leaning more towards treatments, right? So it just kind of depends. I mean, lasers are faster, they're better, they're more effective, but I still think they haven't figured out the whole, this laser works on everybody, meaning Fitzpatrick skin types 1 to 2, 3. But once you get to 4, 5, 6, like us, the lasers just can't be as aggressive because, again, you could end up with scarring, right?
You can scar from a way that, like,
Absolutely.
you can burn your skin.
You didn't know that?
That'll
Laser hair removal will burn you if you don't know what you're doing.
It scars you.
Forever.
Well, reputable sources, guys. You heard this.
She is totally clueless. She's like, oh, laser, it's like so easy. It's not going to do any damage.
I could probably do it.
But again, just understand that everybody is different. The technology that we have, this...
Oh, tell them about the reward you got.
What reward?
Your reward in the mail.
Reward?
Yeah, your award.
Award.
Party.
Look at her.
An award.
She doesn't know the difference.
I do.
An award and a reward is somebody giving you something firm.
Award.
Yeah, she's special.
I felt my hair.
No, she didn't. You kept saying the reward, and I'm
I
like,
felt myself. Just answer the
Okay,
question.
wait, guys.
no. So we were awarded the top medical practice for doing skin tightening in the state of Arizona. Not in the U.S., but in the state of Arizona, we do more skin tightening than anybody else.
And would you say that the tweakment?
No, because I think it's part of surgery. But like I said, I mean, if you do it with chin lipo, then
It's a tweak.
it is a little tweak. So I think, part of that is perspective is everywhere. I would say me and Dr. Benjamin probably do more skin tightening than a lot of other people out there. And I think it's part of one of the things that sets us apart is that we're trying to get you the best possible result. Not necessarily the cheapest or the most expensive, but the best result your body's able to get. And that's why I think that award was kind of cool. Not reward, but
Reward. We know what I said. Or what I meant.
Anything you want to see on the horizon that you think would add or take away from Tweakments that you want to see?
I mean, just like anybody else, we want to see the major reward, right?
Which is what?
I mean, like I want like a lot of skin tightening and not a lot of downtime and without surgery.
Or like, do you think Ozempic is a tweakment? It's just an injection every week.
It is. It's totally a tweakment. Could understand that. It's funny. I go to the gym, right, consistently, and I started to see these people, and I'm like, damn, like they were bigger, now they're smaller, and now they're wearing like clothes that's tighter or whatever, and now they're wearing like less clothes because they're skinnier, and like these girls, but now you see them do stuff, and I'm like, oh, they got loose skin now.
Why are you looking? Janet, grab your man.
Why? Just to do what? And I mean, I noticed this and I'm just like, you go to the gym already. Why would you sit here and get to the point where you're like, hey, I lost my body fat, but now I have loose skin that you didn't need to have. But again, to each their own. So yes, I would agree. Ozempic, Wegovy, Mounjaro, those are good adjuncts. But understand that you have to change up here for that stuff to work.
I want to be the all-treatment.
Mm-hmm. Well, good luck with that. So what do you think?
Tweak.
What do you think our word of the day should be?
Tweaker.
No. Word of the day is holidays. Holidays. So what do they win? Look at these two. They are totally clueless. So what are you guys going to win? Actually, you guys are going to win a free consultation with me if you're interested in the surgical route, or you can win a free consultation with Nurse Scottsdale for Tweakments, since mine are surgical Tweakments and hers are mostly non-surgical Tweakments.
Or one with me too if you're above 6 foot and, you're looking to provide.
There you go. You're looking for a sugar daddy. So if you're out there waiting on this one, good luck. All right?
Then it's a reward.
That's a reward
It's a
that you're going to go,
reward.
that you want some guy who's above 6 feet.
I'm just kidding. At height doesn't matter, but
No.
providers,
There you go. She's looking,
consultations, it's all on the table.
she's looking for a provider, and she's willing to give consultations on how to be her provider.
Yes, but no sugar.
Mm-hmm.
No
That's-
azúcar.
That's how it works. That's how it works. But what are we talking about next week? Do you guys know? No. We're talking about social media and the influence that it carries with cosmetic procedures. So stay tuned for next week, and that's it for episode number 12.
We'll see.
See you guys next time. I hope you had as much fun listening as we did recording. Don't forget to follow us on Spotify, Apple Podcasts, and all podcast sites for new episodes, as well as Instagram, TikTok, and YouTube. Stay snatched, stay hydrated, and until next time, cheers.